Hello, my name is Miriam Dreesen, and I'm currently finishing up my Bachelor's of Science in Diagnostic Medical Sonography. Here is my capstone presentation. The public issue that I decided to research is maternal obesity. Maternal obesity is just defined as having an above average healthy weight recommended by a physician. So the average weight gain for a normal healthy pregnancy is about 35 pounds, and obesity during pregnancy is considered having a BMI greater than 30. According to the March of Dimes, in 2009, 22.7% of women in Nebraska were considered obese at childbearing age, and that rate, along with normal obesity in the United States and Nebraska, has increased in the past decade. Maternal obesity is associated with significant maternal and fetal harm, such as gestational diabetes, hypertension, and then fetal effects such as being born preterm due to those maternal aspects, and being intrauterine growth restricted, or even large for gestational age on the opposite spectrum. So I decided to choose this topic because I am a sonographer, and at my last clinical rotation, I was at the Methodist Women's Hospital at their perinatology clinic, and one of our patient types was just people who were referred to perinatology because they were high risk due to their maternal obesity and their weight. And it was just really difficult to provide good prenatal care to these patients, particularly with ultrasound. Larger BMIs and ultrasound don't mix very well. And also, I just saw a lot of sonography injury during that because it's so hard physically on sonographers to scan larger patients. So the Methodist Educated Citizen Portfolio has three components: effective communicator, reflective individual, and change agent. To me, an effective communicator is someone that communicates with team members, with patients, with everyone. And reflective individual is someone that can reflect on their own strengths and grow those strengths, sees their weaknesses, continues to try to develop those, and just being aware of yourself in different situations. A change agent is someone that is changing things for others, is changing things for a workplace, is changing things in every single person's lives that you're able to come in contact with. So in this presentation, I will talk about what I've learned from my reflections in my educated citizen portfolio and how I'll be applying those to my public issue of maternal obesity. My first effective communicator reflection is a level 3. In this reflection, I talked about specifically an article titled "The Grief of Caring, Self-Care, and Helping Grieving Parents of Stillbirths," and the importance of just communicating your own personal needs when you're dealing with grief and loss with patients. I just learned that healthcare professionals will tend to draw back from those feelings, and it can be unhealthy. And this can actually harm patient care as well. So just really help me learn about how effective communicating in your role as a sonographer, as whatever your healthcare profession is important for both your patients and for yourself. How this can kind of tie into my public issue is whenever you're dealing with high risk and maternal obese patients, I know that I'll be able to more effectively communicate my emotional needs to my coworkers, to my bosses, and just what I'm needing more clearly to people around me. And I know that I will also be able to communicate risks and educate my patients who are on the maternal obesity spectrum, and just be able to be a provider for them. My second reflection is my level 4 reflection, and at this reflection I specifically talked about a time when I took care of a very sick patient as a CNA on my medical surgical unit. The patient, I wasn't sure if I was getting an accurate pulse ox read, and I just kind of continued to communicate with the nurse that I was working with who was taking care of this patient. And I learned when it is important to be direct, clear, and appropriate about your communication, specifically when you're in front of family members, when you're in front of a patient, and you're trying to decide how worried should we be right now. So I just talked about a situation like that. This reflection, I think, really helped me to know when it is appropriate to talk about certain patient conditions in front of family members and patients. Maternal obesity can be a very touchy subject about a lot of people because it's their weight and it's women. So I just think that this really helped me reflect more on when there's emotional topics that need to be discussed and how to appropriately communicate with my healthcare team that I'm working with. Next, I'll be talking about my reflective individual portfolios. The first one that I use is a level 2. In this portfolio, I reflected on myself and just realized when I was first working as a CNA that I am a very task-oriented person. I really love to check off my boxes, get my to-do list done, get my patient done, and just move on. And I learned by reflecting on that even though I was checking the boxes of what my tasks and my duties were as a CNA, I was overlooking my patient's individual needs that might not be on my list of to-dos. And I just learned the importance of holistic healthcare and individualizing care for each patient. So again, with maternal obesity, it's the same thing. Everyone has different backgrounds and different struggles that have maybe led them to be in this maternal obesity state. And just really stepping back from just what's my job, what images do I need to take as a sonographer, and really investing in my patients and giving them the holistic care that they need. My second reflection is my level 4 reflection, and this was a personal reflection on how I experience and how I deal with loss and grief. I wrote about how I was worried as a person going into healthcare, where there's a lot of worry, there's a lot of loss, there's a lot of grief, that I have been very blessed in my life and I haven't had a whole lot of loss in my life. I haven't known it a lot personally, and that worries me because I might be surrounded by it, a lot of it. So this reflection really helped me learn that I know that I'm going to need to lean on others, and that I need to continue to look back at myself, check in on myself, make sure that I'm handling cases and difficult situations appropriately, not only for my own mental and emotional health, but also to make sure that I'm giving the correct and appropriate care to my patients. Again, tying this back into my public issue, maternal obesity has a higher risk of loss, has a higher risk of complications. I know that because of this reflection and because of me being aware of my weaknesses when it comes to loss and grief, that I'll continue to always reflect back on myself to make sure that I'm appropriately handling my grief with their case, but also providing the right kind of care. So the last aspect of educated citizen is personally my favorite, a change agent. My first reflection is my level 2. So this one I used my ethics class, my medical ethics class, and I talked about the story of Sisyphus by Albert Camus. And Sisyphus is his life is just pushing a boulder up the hill and it rolling down the hill over and over and over again. And the whole meaning of the story is that Sisyphus still found meaning and joy in his life because he was able to continue to live, because that was his punishment for something bad that he had done. From this story, I just really reflected in that everyone's lives and everyone's circumstances, no matter how hard they are, they can have, their lives have meaning and they can have joy. My role as someone that gets to touch so many lives in one day as a healthcare provider is that I have the ability to create some joy in someone's life. This can go to any kind of patient, but pregnancy is difficult enough. When you're also dealing with complications that come with maternal obesity, it's even harder. Different health problems come up, and every patient deserves the same kind of attitude from me as a healthcare provider to be able to, can I put a smile on your face? Can I make a joke that'll make you laugh? Can I listen to you while you tell me about some struggles that you're personally going through? If I can make that kind of difference for any patient, for maternal obese patients who may feel alone and stranded in their care, then I'm a change agent for one person's life. And if that's all, then that's enough. My last reflection is my level 4 for my change agent. And in this reflection, I talked about how when I was a CNA working, I joined a committee of my unit that was composed of other CNAs, of nurses, and then of some leaders in our unit. And we were just realizing that we had these new hires who were training, and there was just a lot of things that kind of fell through the cracks during training, and there was lots of misses that were kind of hurting patient care, hurting our unit, hurting other coworkers. So I joined this committee to kind of rewrite how we're training new CNAs, especially because at the time I had only been there for a year, so I had personally known what it feels like to, I didn't even know I was supposed to do that. So what I learned from this is that if you want to see change in a unit, if you want to make a unit better, if you want to make anything better, you gotta get up and do something about it. Sometimes a role in a job, if you want to see something new, it's more than what you think you just signed up for. But again, if you want to see change happen, you have to make change happen. And from this reflection of being a change agent, from just this small, little, short thing that I did, I want to see a change in the lives of women who are struggling with maternal obesity. And if I'm just sitting down, nothing's going to happen. I need to be reaching out to community leaders about what can we do as a community to make more resources for these patients, to perinatology programs to continue to provide better care, and educating. And just from this reflection, and I think this one more than anything, is that being a change agent takes action, it takes effort, and if I want to see it, then I need to put that in. So all in all, maternal obesity is something that I found super passionate about when I was in clinical, and I'll continue to come in contact with this kind of patient for the rest of my career as a sonographer. And feel like because of how the Educated Citizen portfolio prepared me, I'm able to really apply these aspects to my patients and my job more. I can effectively communicate with coworkers, with patients, with community leaders, and whoever else is necessary to change the lives of expectant mothers who are struggling with maternal obesity. I know that I'll be able to appropriately reflect on myself and my patients as individuals to continue to grow as a holistic healthcare provider in handling each and individual patient. And then I can be a change agent because I am put in a position with my job and with my degree and my situation in life that I can change individuals' lives and I can change things for the greater good. All I have to do is put some effort in and get up and do it. And here are my references for my data I collected for my public issue. Thank you so much.